Day, you need to take those 2 boxes of insulin home with you and put them in the refrigerator, okay? Then when you get ready to use a pen, you take it out of the refrigerator, start using it, but you don't put it back in the refrigerator. So the pen you're using, you don't put back in the refrigerator. You leave it at room temperature as long as it's not hotter than 85 degrees in the room, okay? All right, so this is what Novolog looks like in the pen. It's got an orange label and orange button, okay? Your Tresiba is kind of this color of blue, but it's got a green label, I think, a different color green or something like that. So, okay?
Okay.
All right. We always attach a brand new pen needle each time, right?
Right.
Okay, so remember that one pen comes pre-filled with 300 units. So you use the same pen over and over and over again to use all the insulin up, or 30 days. Well,
Right.
this one is 28 days. Tresiba is actually good out of the refrigerator for something like 52 days, something like that. However, her doses at the moment, if 30 units of Tresiba, 30 into 300 would go 10 times, so one pen would last her 10 days, but there are 5 pens in the box. This one, if you only eat twice a day, 20 into 300 would go 15 times, so one pen would last you about 15 days.
Okay.
Okay? So we clean this end cap off with alcohol, right?
Right.
You take your little pen needle,
And twist it on
take that little tab off, right?
Mhm.
Needle's inside there. You may have some at home that all you have to do is just push on by itself, but the one I'm showing you, you push on and righty-tighty to screw it on there.
Right.
You take both your caps off to expose your little needle. Now, were you taught to waste 2 units every time? Were you taught to dial to 2 and waste 2 units every time you put a brand new pen needle on? That doesn't sound familiar? Okay. So dial it to 2. 1, 2. Hold the pen upright, push the button in on the end, and make sure you see insulin come out the end of the needle.
Right.
Okay, now it zeroed itself out. Now you dial it to 10. 1, 2,
okay.
3, 4, 5, 6, 7, 8, 9, 10. Did I get it on 10? I believe I did. Okay?
Okay.
All right, where do you normally inject insulin?
I usually put it in my stomach.
Perfect. It's the best place to do it. So just as a review, find you a little patch of real estate, as I call it. I have lots to work with. Clean that off with alcohol, okay? Fan or dry. You don't want to put a needle in wet alcohol, it'll burn, okay? Then I like to hold it like this and use my thumb to depress it in. So you go straight in with it, push it all the way in. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, let go, pull out. Okay? The next time you inject, maybe do it down here. The next time over here, the next time over here.
Okay.
Always in a new location.
Right. Okay.
All right. Got to take this pen needle off each time. All right. Don't recap with my little green sheath here. Don't recap with this. Recap with this.
Okay.
Clear cap. You push down and lefty-loosey to unscrew it off of there. Okay?
Okay.
And you're good to go the next time. All right, did that seem familiar to you?
Yeah.
Okay. And to you too, Miss April?
Yes, ma'am.
Okay. That's how, I don't have a Tresiba pen, but they work the same. The reason that you dial to 2 and waste 2 units each time is to get air out of the needle there, okay?
You know, like we used to do with the old school one, when you used to pull back and then tap it and then let the air out. It's the same premise.
Yes, exactly.
You remember that?
I don't know, April.
It's okay, Mama. We got you.
Okay.
And a quick question.
Yes.
Just for clarification for my dad. You do the 2 every time or, okay.
And a brand new pen needle each time.
Okay.
And always remove it after.
After you finish the injection.
Yes. And just FYI, I got a whole little sheet that's got pen tips on it too. I meant to highlight. As 56 days, I was wrong about that, but that pen's not going to last for 56 days.
Okay.
out of the refrigerator.